We've been reporting a growing amount of optimism among doctors and researchers that perhaps, at long last, we've reached the peak of Omicron, and maybe, fingers crossed, we're starting to see the end of the pandemic as we know it.
Yeah, Chicago's top doc, Dr. Allison Arwady, used the phrase a sense of potential relief. So we're happy to be joined by the top doc of Chicago this morning. Thanks so much for coming on. We appreciate it.
Happy to be here.
All right, we're going to be talking numbers here in just a moment, but I want to ask you really quickly because we know that the mayor had tested positive for COVID. How is she feeling and how is she doing?
She's doing just fine. She's vaccinated and boosted, which of course is the most important thing. Yep, we've been touching base and she's doing fine.
I want to take our viewers to Boston, where this week they tested the wastewater and they found a 70% drop off in Omicron compared to just a couple of weeks ago. So that's the Northeast corridor. Does that give you any indication of where we are here in Chicago with regard to this, hopefully this big drop off in COVID numbers?
Yeah, so I want to be really clear. We've not seen a big drop off in COVID numbers at this point just yet, but we are feeling increasingly optimistic that that big increase is flattening. And as you know, that first step of progress is seeing the curves flatten. We're still seeing hospitalizations and deaths go up because those are people who may have been infected already. And I want to be clear, even if we peak here, there are thousands of people getting cases every day. But the most important thing is that vaccine is helping keep people out of the hospital. And yeah, I like these charts you're showing right here because these are the ones I look at every single day. The folks filling up Chicago hospitals, not every single person, but just about all of them are still unvaccinated. So now's the time to do that. But yes, a moment certainly for some cautious optimism. Not quite ready to call it, but feeling better certainly than I did just a few days ago.
You know, this morning, our reporter Joni Lum, she is covering the issue of COVID and the vaccine mandate as it pertains to businesses. And a lot of businesses are saying that they're really hurting financially. I mean, you're obviously trying to do what you can to keep the city safe, but you have unvaccinated people who are not able to go, obviously. So that's a drop in potential sales. But you have vaccinated people that don't feel comfortable giving out their information. And these businesses are really hurting. Can we expect at some point that will be reassessed? Will you be pulling that back?
Yeah.
Where do we stand on that?
Yeah, absolutely. So I want folks to hear that really the things that are in place right now are because we are at this very high, in no way sustainable COVID numbers. But as we move through this, as we get back down to what the CDC defines as lower or more moderate risk, in the same way we were able to take masks off last summer, I expect we would be able to have masks off and that we would not have that vaccine requirement in place for high-risk businesses. It's really about the epidemiology. It's not politics. It's just that right now, the chances of being in a high-risk setting for folks who are unvaccinated is just really high. And I can't risk more people who are unvaccinated getting COVID and then ending up in the hospital. So no, these are not forever. But for right now, while the risk is high, if people have made that choice not to be vaccinated, it's just important that at the city level, the optional fun, not the essential things, but the things that we do all love to do right now, those, if they're higher risk, are only open to folks who have chosen to be vaccinated, but not forever.
All right, let me ask you this. So it seems to be there's a silver lining with Omicron compared to Delta with regard to outcomes. And yet we are hearing now about this flu-rona, this combination of the flu and Omicron. What do you want our viewers to know? Is that happening here in Chicago? And are you recommending a flu shot in addition to those of us who are, in fact, boosted?
Yeah, so I definitely recommend a flu shot. It has been possible all along. We have seen examples of people being infected with influenza and coronavirus at the same time. Those are not the same family of virus. It's not that we're seeing a combination or a mutant virus between those. It's just that if you've had coronavirus, that's not like having had flu. They work differently. So I definitely encourage people to get a flu shot if they haven't. The numbers of people getting co-infected, we call it, are not high, but it just reinforces that this is our respiratory virus season. When people are inside and gathering, and particularly when spread is high, doing everything you can to help keep yourself safe. That's first and foremost COVID vaccine and booster. But yes, right along with it, getting that flu shot. And it's not too late if you didn't already get one this year. They're available pharmacies, providers all through the city.
Critical information courtesy of the Chicago Health Commissioner, Dr. Allison Arwady. Always a pleasure to have you on Good Day. Thanks for your time.
Thank you.